Hi, Dr. Rubino. Thanks so much for connecting with me today. So we're going to be working, my name is Dr. Lauren Young, and we're going to be connecting today to talk about a topic that is passionate for both of us, varicose veins. It's one of those things that can really haunt people, and it also can hinder them in a lot of different aspects of their life. And I think there's a lot of misconceptions around it. So we're going to get together today and talk about that. Just to let you know what we're going to be diving into. We are going to talk about risk factors, understanding how varicose veins happen, and then looking at options both from the integrative prevention aspect and then also surgical options. So you can kind of have all the information you possibly could want about varicose veins. Just so you know, we're doing this because we like working together and we like empowering our patients. We're not getting paid at all for this. And everything we're talking about today is something you should talk about with your doctor because there may be things that are unique to you that you want your doctor to address. Dr. Rubino, you want to chat about yourself?
Sure. I'm a surgeon that specializes in varicose vein treatment, and we've come a long way with what's able to be done in the office for varicose veins. My background is 5 years of residency in surgery, which included vascular surgery, and I do a lot of these procedures now for varicose veins in my office, as opposed to when we started, which was often a hospital procedure and also an admission. So things have come a long way.
Awesome. So in my background, I'm a naturopathic physician. Like my grandma here would say, I'm almost like a real doctor. So I'm licensed in the state of Connecticut, and we are trained like primary care doctors in every way, except for we also are trained in evidence-based integrative medicine. So everything from botanicals, nutrition, lifestyle medicine type things. So it's a great way to be preventative and also integrated with other specialties. Dr. Rubino, you want to chat about what are varicose veins?
Sure. So varicose veins are blood vessels in your legs that seem to not be able to carry the blood from the foot back up to the heart. There's two systems that these can be affected in. The deeper system, which is along the bone, and the superficial system, which is what you would see as the bulging veins. The deep system is always checked when we're doing the ultrasounds to make sure that it works. And the superficial system is something that will sometimes not work for people depending on what the incident is that caused it. The first thing can be a hereditary factor, and the second thing can be an injury. It will lead to things like that heavy aching feeling, especially at the end of a day. You might see some swelling in the legs and maybe some throbbing. It may prevent you from doing things like walking or going shopping or doing things at an end of a day because it's just too tiring for you. And if you stand for long periods of time at work, it may even accentuate that. Sometimes over the vessels that are visible in your legs, you might see some skin changes and maybe some itching, and you can also have a color of the skin change and the texture of the skin change as well. So these are the definitions of what a varicosity is and what a spider vein is and what they look like. So the varicosities are larger. They sometimes are described as a ropey, bulging type of a vessel underneath the skin. And the spider veins are the veins that are in the skin. The reason that these things happen is depicted right here. It shows that there's either a damage to the vessel, like a fracture of your leg with a dislocation, or it can be a surgery, previous surgery, or it can be a hereditary factor. And what happens is, if you look at the right side of the screen, there's valves that are closed in the center one, and then there's valves that are open on the most left-hand side. that shows that the valves are competent and that they're working where the blood can go up and it's held in place by those valves. When the valves don't work, like the one on the most right-hand side, this is where the blood goes up, but then it comes back down again because the valves don't hold it in place. And on the left-hand side of the screen, it shows those ropey vessels that develop for after long periods of time of the valves not working. So what the way that we determine whether the valves are working or not is by using an ultrasound. And that's what this picture shows. And it shows the flow inside of the vessel as well as the size of the vessel. So the things that you can attribute to varicosities is number one, being female. It's a 4-to-1 ratio of women to men. You may have a family predisposition to it. And if your mother had spider veins or large vessels, it doesn't necessarily mean you'll get exactly the same thing, but you are predisposed to at least some type of a varicosity. If you see some changes in the veins in your legs at an early age. Being older because we've weakened the vessels over time. Overweight sometimes causes some of those spider veins to happen more. If you have a job that you're standing for long periods of time, the pregnancies that you may have had in the past can contribute because there's a lot of pressure on the venous system from the weight of the fetus. There's other medical conditions that could cause it, but primarily it's a hereditary predisposition. We're not sure what the oral contraceptive relationship is with varicose veins, but we know that it does sometimes increase the varicosities. Being inactive is a problem for the varicosities because if your legs are in the dependent position, which means that they're down or you're walking or you're sitting for long periods of time, it can mean that you're not helping to move the blood out of the system. So being inactive is again a risk factor. And then, of course, we discussed already the leg injury. So the things that we talk about that you can do to help somewhat to prevent and somewhat from them to prevent them getting worse is to wear a support stocking. And that's because what the valve is not doing, the stocking will do. So the valve is not holding the blood in the leg at different sections of the leg as it moves up from the foot to the groin, but the stocking will help to compress those vessels so that so much won't accumulate in the most dependent areas like the ankle and the lower calf. So we discuss, using the stockings, which a lot of people don't like, but after you get used to wearing them, sometimes the symptoms are helped so much that they are more comfortable. Exercise is also another option for you because the muscles will then push the blood out of the lower portion of your leg, and that will help with some of the discomfort that you have. And then when you're sitting down, you can keep your legs elevated, which would mean that the blood flow is assisted by gravity. Not crossing your legs just helps to not compress the vein, so it helps the blood to move out of the system. These things here, I think Dr. Young can discuss about and review.
Sure, absolutely. So, when we were talking about prevention and talking about healthy body composition, having a healthy weight, exercise, there's so many aspects of lifestyle medicine that can play a role with helping prevent this. While we were kind of putting together this lecture, I found this really interesting study where they took people's blood from the varicose vein and then also at the same time from the typical place where you get a blood draw on your, inside of your elbow. And so when they did a draw of the same person, same time, 2 different locations, what they were finding is a huge amount of inflammation found around the varicosity. So there's inflammation happening in this process because this blood is pooling, it's not moving the way it needs to, the tissue is irritated by it and also compromised to begin with, which is why the blood is pooling in that area. So like many other diseases and conditions, we just want to be really mindful of addressing inflammation. Not that it's the root cause of this. Obviously, there is a lot of genetic predisposition and some other lifestyle things or trauma that can put a risk factor to it. But reducing inflammation is always a good way to help support the whole body. And if we're seeing inflammation in these varicose veins, it's certainly an ideal situation is reduce the inflammation all over your body to help prevent any other further exacerbation of this. So ways to address inflammation in the body would be, again, movement. Movement, it does so many things to reduce inflammation. It tells our immune system to amp up and then relax, so that you actually can watch inflammation decrease with exercise over time. A balanced whole foods diet without a lot of alcohol, caffeine, or sugar, refined sugars, will definitely help reduce that as well. Hydration is so incredibly important, and so is managing your stress overall. So there are lots of different ways that you can help support your body, and these are all very well studied in how they're going to impact inflammation, which again could be a potential component of what's going on with the varicose vein system. A lot of people go to the health food store and they're going to find, this supplement is good for varicose veins. So I kind of want to talk about supplements at this point and their ability to help with this. Nothing is going to change your structure. Once we saw that picture with the valves are not going to suddenly be like repaired by taking a supplement. Our goals really with taking any kind of dietary changes or supplementation when it comes to varicose veins are really just going to be overall to support collagen production, support the health of the vein wall, and to reduce inflammation. But it's not going to change a structure. If you already have varicose veins, those valves are compromised, that tissue has changed, it is inflamed, and we want to look at structural options and solutions as well. Another quick word about supplements is that this industry is self-regulated, which means that anyone can put anything into a bottle and say that it's whatever they want to say. They can put whatever they want on the label. There's no control over this field, which is a little terrifying, but at the same time, there are a lot of really good ethical companies out there that have really good products that can make a big difference. So one of the main things is to make sure it's GMP certified or general manufacturing certification. So that will say they had to test the ingredients before, when they came in as a raw ingredient, before they go into a capsule or tincture bottle. Then they have to test them afterward, and then they have to test them 3 years later before the expiration date. And they also have to have an expiration date because otherwise they don't necessarily have to. So this is one of the things you want to look for amongst others, just to make sure you're getting a good quality product if this is something that you and your physician decide is a good idea. So my favorite herb when it comes to varicosities, and another place you see varicosities are hemorrhoids, which are essentially varicosities that are impacting around your rectum and can present with, again, similar symptoms of itching and irritation. Sometimes there's actually even like a little bit of blood in your stool. So there's a lot, horse chestnut is a very safe herb. It doesn't interact with a lot of things. And it's been around for a very long time. And they've done some really wonderful studies showing that while it can also reduce inflammation, it has been shown to improve venous tension. And they had one study comparing it even to wearing compression stockings and finding some benefit similar to wearing compression stockings. So definitely one of those things that not very expensive, very safe, and something to consider if this is something that you're dealing with and or, it's in your family history kind of thing. Definitely talk to your doctor about it. Gotu kola is an herb used by many. This is a picture of it. It's a cute little thing. I had it in my garden. It's a wonderful, it helps the nervous system as well as helping the microcirculatory system in your body. So they found that it can help with wound healing post surgeries, and they've also found that it can help with varicose veins. It does have a tremendous amount of drug herb interaction, so it is one you want to talk about with the physician as well, but is very well tolerated as long as you're not on medications with it. It also, like, again, I put in here, it can help with other things as well, other skin conditions, psoriasis, anxiety, insomnia. It's a pretty adaptable herb. And again, grows locally, and it's cute. Butcher's broom is another herb that you'll see in a lot of these formulas. It's loaded with saponins and polyphenols that really support vein health. Polyphenols are essentially like one of the benefits of blueberries and things like that, which also are counted to be great for vein health. And this has been fairly well studied in several different conditions, but especially with varicose veins can be beneficial. The cute little red berries are right there pictured. Again, it can have a lot of interactions and some side effects, so something to talk about with your physician. This is a medical food and also a supplement. So diosmin or Daflon 500 is the name of it. It's basically a concentration of a bioflavonoid found in citrus. It's found in the pith, like the white part you peel off, and you hate it as a kid. That part actually has been found to have this bioflavonoid that is amazing for vascular integrity. And they've found that, that supplementing with this on a regular basis is really beneficial. The one study was looking at like hemorrhoids in pregnant women and found that a dramatic decrease in hemorrhoids. And it's very safe, obviously, that they were doing a study in pregnant women. Yes, you could eat the pith of an orange, but one capsule is the equivalent of 140 oranges a day, which I don't recommend to anybody. So it is a pretty neat thing. Again, I'm not getting endorsed by anybody, but vascular is a prescription. Sometimes it's covered by insurance. You do need a physician to prescribe it. The other is a not it's a physician grade supplement, but it is pretty neat that these bioflavonoids, and I have to think that this isn't the only one, bioflavonoids really strengthen vein walls and can help with that microcirculation. So again, speaking to a whole foods diet being something that we're now seeing research into helping. But when you've exhausted your options, you're sick of wearing compression stockings, this is when we talk to Dr. Rubino about what are our options.
So the things that are listed here, discuss the conservative methods as well as the more definitive and permanent treatment. And elevation of your legs is one of the things in compression stockings that we recommend initially, because if it does help, then it means if we fix your varicose veins, then we probably will get a good result. The sclerotherapy is primarily used for the spider veins and the smaller vessels. And then the thermal ablation and vein stripping and venous seal closure are the methods that we use for closing the main superficial vessels. It has come a long way from vein stripping, where we rarely ever use that, and now use a thermal ablation or a radio frequency closure of the vein, or a glue by the venous seal method, all of which are the same type of treatment. It's just different methods. So they all either remove or seal the vessel closed. The phlebectomy is primarily used for vessels that are still persistent after you do the main closure, but they're too big to be using the sclerotherapy on. So we make a tiny pinhole and just remove them. So the invasive portion of this is very minimal, and most people tolerate the newer procedures very well. This is a description, a pictorial description of the vein being closed, and with the right lower quadrant, right lower pictures, you'll see the catheter inside the vein, and when you turn it on, it seals the vessel closed. And primarily the method of the energy source is a radio frequency energy source, which is a very good way to close these vessels, because post-procedure there isn't a lot of discomfort. So people do very well from this.
Do people have to wear a stocking afterward at all?
Yes, for the radio frequency closure, you do have to wear a stocking for 2 weeks afterward.
Okay. After that, are there many restrictions?
No, you can resume your usual activity level, and I always recommend that people use a stocking whenever they are able to use a stocking. So if you have a history of varicose veins, we can treat all the varicosities that you have, but we don't know which ones are going to blow one of those valves in the future. So if you use a stocking, as much as possible, you're going to find that there'll be less of those valves that will open up in time. You can't prevent it all from happening, but it is a good way when you can use them to control some of this. And I know that most people don't wear their stockings when it's 90 degrees out, but when it's cold out and you're wearing a stocking anyway, you might as well wear something that's helping you. So that's what I tell people.
For sure.
So the other method that we're showing here is the Venus seal, which is like a glue, kind of like a crazy glue for veins. And the right side is showing that the vessel is closed and the compound is inside the vein. And as you start to pull the catheter out, it just seals the vessel closed. So it's a very easy method, and it's a very nice way to close the vessel without a lot of side effects. So primarily the patients will experience what it's like to draw blood or to start an IV because the catheter is quite small. And as we put the catheter up the leg, we just seal it closed. And that's the whole procedure. It doesn't take very long to do. And there is no downside to it in that you have to wear a stocking or limit any of your activity. So people are very happy with this method as well.
Awesome. Thank you.
So this is a picture of some of what the differences are for beforehand and after. The pictures show maybe some residual vessels afterward, which we will go back and either, as we described before, sclerose or with a tiny pinhole remove, but the majority of the large vessels are usually closed off.
Wonderful. And it's nice to know that the options have become so accessible and safer and easier,
Yes, all done in the office.
Very cool. Thank you. Well, thanks so much for connecting with me today and chatting about this. And thanks to everybody who's sitting at home watching us. I appreciate it so much. And we'll be doing more of these types of things in the future. So stay tuned. And I'll talk to you soon, Dr. Rubino. Thank you.
Thank you for having me. I really appreciated it and I enjoyed this very much. Thank you.
Thank you.